Hello, guys. Do me a favor and come in and let me know where you are watching from. I am going to, I need to paste something into the chat, and I can't do that from my phone. So I got my computer pulled up here too. So I can paste in the chat the link to the group study session that I have coming up on Saturday. Well, next Saturday, not tomorrow, next Saturday. A few of you guys have asked me when I'm going to do it again. And so I said, let me come on here and do it. So I just scheduled it on Calendly. So I just wanted to tell you guys about it. As you come in, just do me a favor. You guys know the routine. Let me know where you're watching from. I'm just putting the link. What is it? Group study session. I'm putting a group study session, and then I'm going to paste it. Let me see. Is this it? Yep, I'm going to paste it. So I got it. I mean, not paste it. I'm going to pin it. So, hey, guys, let me know. Hey, is that Margie? Hey, Margie from Florida. Marjorie. Okay, sorry about that. Hey, Sam from Texas. You Missy. Hey, you Missy from Connecticut. Hey, guys. How are you guys doing? Let me know how you guys are doing. Come on in. Continue to let me know where you guys are watching from. Sorry guys, I should have put my phone to do not disturb. I got calls coming in and text messages. But guys, let me know where you are watching from. Also, let me know your status. So as you're coming in, just do me a favor and let me know, are you a student right now? Did you just finish school and you're about to get certified? You're already a medical assistant, you're seasoned, you're a brand new medical assistant. Let me know, or you maybe not a medical assistant yet, you're thinking about it. So let me know where you guys are right now, and I'm curious to know. But in the meantime, as you guys are doing that, let me introduce myself for anybody that's new to me. My name is Kendra, aka Miss K. I'm a medical assistant instructor, and I've been in this field since 2004, and I've been an instructor since 2011. And so what I do on this channel, for anybody that's new, I help people pass certification. I also have some clinical videos on here where I show you guys how to draw blood, check vital signs, and all of that good stuff. And sometimes I just pop on live just to say hi, like today. But I also wanted to let you guys know my group study session that I have coming up next Saturday. Sam Joe says, I'm nervous. I'll take my exam tomorrow. Oh, okay. Okay, gotcha. Okay, so just Sam, if you know what your weak areas are, meaning the areas that you struggle with the most, just try to double down on studying those areas, okay? And depending on which test you're about to take, search for the test plan. You just simply go to Google and just say, free test plan, and then enter the exam you're going to take, and then just look at the test plan. Use it as a checklist just to make sure you know everything that's on it. And that goes for Sam and anybody else that's about to take the test. Anna, I see you just finished class and you're studying. So yeah, use a test plan as a checklist. And I have study tips. So if you guys are preparing for the certification and you need study tips, just go to my channel playlist and you will see study tips. For anybody that's preparing for certification, I have a group study session next Saturday. I have the link posted. It's pinned in the chat. I have done these in the past. Sorry, guys. I'm on the main street, so you may hear sirens in my background. Is that a police car? Or sometimes, I don't know if it's a police car or ambulance. It sounds like a police car. Hold on one second, guys. I live in DC, and I'm on a very busy street. Oh, yeah, those are police cars out there. Oh, and an ambulance. Okay. So guys, I live in DC. I'm on a very, very busy street, and and the hospital is a couple blocks up. So that's why sometimes when I'm on live with you guys, I get a lot of background noise because busy street is rush hour right now, and then there's a hospital a couple blocks up. So yeah, hopefully that's it. And then you'll hear like some motorcycles and stuff going past too. So please excuse it, y'all. I live on a very, very busy street. I'll be through with my program by April. Okay, your CCMA exam is in May. Okay. Studying, feeling overwhelmed with yeah, it's a lot of information. That's why you want to use the test plan. Just search for test plan. Just go to Google and go free test plan, and then whatever test you're taking, and it'll come up. Use it as a checklist. Congratulations, Portia. Portia says she passed her test today. Congratulations. All About Stella's watching from Florida. She finishes externship in 3 days. No test date yet. Okay, you're taking CCMA. Okay. Took my test Tuesday. I found out the next day. Congratulations, Donna. Listen, everybody that's watching that just passed your test, congratulations to you guys. Congratulations to everybody that recently passed. If you're preparing, good luck to you. I'm having a study session next Saturday on the 8th. And oh, that's what I was saying before the sirens interrupted me. So I do these study sessions. I've done them a few times in the past, and the goal was to do these once a month or at least every other month, but I don't get to do it that often. But I've had quite a few of you asking me and on Facebook, when is the next time I'm going to do it? So I scheduled it for next Saturday, March 8th. It's at 11 a.m. Eastern Standard. And it's even if you're not about to take your test and you just want some time to ask me questions or whatever, you can go ahead and sign up. And let me know if you guys have any questions while I'm on here. I'm going to stay on here for a few more minutes and then I'm going to go eat. Let me know if you guys have any questions while I'm on here. I'll give it a couple more minutes to see if any comes up. Portia says it was similar to what you taught. I learned so much from you versus school. I'm so glad to hear that, Portia. I'm glad that my videos are helpful. So it makes me happy when you guys tell me that, because that's the goal. Thank you. And again, congratulations. Yep, Sam, you Google NHACC. Yep, study plan. Test plan. Not study plan, test plan. And it's going to take you to NA. You can, since you're doing it through NHA, you can literally just log into your NHA account and you should be able to find a test plan that way. But I usually say Google it because it'll take you right through it, take you right to it. And what it is a breakdown of everything you need to know for the test. So since you take your test tomorrow, you want to make sure you go on there and make sure you know, you want to check off everything you check it off. Okay, I know this, I know this, I know this, I know that. Okay, I don't know that. So let me go back to my study guide and go look at that. Right? So that's the point of using the test plan. Congratulations. Is that TNT? Congratulations. Kimberly says, I'm coming to you from Illinois, I should say. Taking an exam to recertify. I let my certification lapse for more than 3 years. Okay. And that's common. So this is a good point. I'm glad you brought this up because people have asked me, what do they do if their certification expires? So you do have a grace period. If you don't recertify within a year, it will lapse and you'll have to take the test again. And so in this case, this is Kimberly's situation. So for those of you that are wondering what happens if your certification expires, they give you a grace period, depending on which certification, is usually a year. And then if you don't recertify within that time, you have to take it again. And Kimberly, so a couple different things you can do. You can maybe sign up for the study session I have next Saturday coming up on the 8th, or you can get my MA refresher course since it's been a few years. For those of you that don't know, I have an MA refresher course that is for people who need to get a refresher, like people like Kimberly, been out of school for a while. Or if you're fresh out of school and you need to prepare for certification. It's at marefreshercourse.com. I'll put that in the chat as well. It's www.marefreshercourse.com. I think most of you guys probably know about it already, but for those of you that maybe don't know about it, I just put it in the chat. Aloha from, is that Hilo, Hawaii? Just took my CCNA on the 22nd and passed. Congratulations. Tell me what that means, Terry. What does that mean? Mahalo for your videos and encouragement. I'm guessing that means thank you. Let me know, Terry. I'm learning something new today. Thank you, Terry. And you are very welcome. You're very welcome, Kimberly. Very welcome. You guys are so welcome. You're welcome, Sam. So guys, yes, I just wanted to let you guys know that I'm doing this study session. So usually on a study session, I have people submit their questions in advance so I can prepare. So let's just say I'm going to use Kimberly for an example since I see your name. So let's just say Kimberly, she signs up for my study session and she puts in the notes, I need help with dosage calculations. What that does for me is it helps me prepare for the study session. So I know, okay, on the study session, I need to be prepared to have a few problems ready or a few examples ready to do dosage calculations. Or let's say Terry, for an example, says, I need help with EKG. Then I know to prepare a lesson on EKG. So when you guys sign up, that's why it's so important to put in the notes so I'll know what I need to prepare for. Or if someone says, I need to know the parts of a cell. Listen, I don't teach parts of a cell every day, so I got to go. Let me go refresh myself. So let me get prepared to reteach this. You know what I mean? So just help me. It helps me to get prepared for the session. Terry says now I'm a CCMA, CNA, COCA. Wow, congratulations. Now, okay. So CNA, CCMA. What is COC dash A and CPC? Let me know what that means. Is CPC, is that certified phlebotomy? Is that, let me know what those are, Terry. I have no idea. Oh, she said yes. Mahalo is thank you. Oh, okay. I'm learning something new today. Every time I come on here, I learn something new from you guys. Thank y'all for hanging with me on a Friday afternoon. I'm actually about to go eat. I said, let me go live real quick. Okay, certified outpatient coder. Oh, cool. So you a coder and okay. Um, Funny. I just came across a position. I got an email. I have notifications from Indeed, and something came up about a remote coder. So that's the good thing for those of you, because some of you guys asked me what I think about like coding. That's the good thing for those of you guys that are in, on the administrative side, like billing and coding. You can work remotely. There's so many positions where you could do remote billing and remote coding, even scheduling appointments, working for the call center. There are quite a few remote jobs that you can do on the administrative side of medical assistant. Now, on the clinical side, you guys know, listen, you got to be in person for that, okay? You got to be in person for the clinical side, even though there are you know, some positions that are available for clinical medical assistants at home too. But for those of you that want to get into remote work, you may want to look into the administrative side. Oh, thank you so much, KM. Thank you. I appreciate that. What time is the group study? So, Yosemite, I'm sorry, what was it? Yamisi, I'm sorry. I hope I'm saying that right, Yamisi. So it's 11 o'clock Eastern Standard Time. So I'm not sure what time zone you're on. Let me know what time zone you guys are on anyway. But Eastern Standard, if you're on Central, that will be 10 a.m. for you. If you are on Pacific, that will be 8 a.m. for you. And that's going to be next Saturday, the 8th. That's going to be next Saturday. Thank you, KM. That's going to be next Saturday, the 8th. So 11 a.m. Eastern, that's my time zone. And then 10 a.m. Central and 8 a.m. Pacific. And then what is the other one? Is it Mountain? That's 9 a.m. Okay, Kimberly is Central. So yeah, that would be 10 a.m. for you. And it's up to 2 hours. So however long we need to be on there, up to 2 hours, we'll be on there. There's been times where I've had these study sessions, and I've had like 20 people on one session, and we went like 2.5, almost 3 hours. And then there's been a couple times where I've only had two people. I've had twice where there were only two people, and we didn't even go the whole 2 hours. Or sometimes it's maybe 5 people. We might go an hour and a half. So it just depends. So once you're on there, we just go. The max is 2 hours. The max is 2 hours. So, but like I said, we had that time where we had like 20 people on there, and literally we were on almost 3 hours, just going over whatever, question you have, whether it's related to certification, or maybe you in school and you like, Miss K, I'm struggling with anatomy. Can you help me with this? Or if you're like, listen, I need help finding a job. I just want to talk. I just need encouragement. I need help with my resume, whatever it is. It's all things medical assistant. Oh, is that Portisha? Portisha? I'm sorry, y'all know I be messing up some names. I'm sorry. She said, why medical assistant and not MD? That is such a good question. Listen, I shared my story one time on here, but let me know if I'm saying your name right. I don't know if it's Portis. I'm sorry. Let me know what your name is. But so my goal was to be a doctor when I was a kid. I was going to grow up and deliver babies. But life happened. Some things happened during my teenage years and all of that. Went through some things. And by the time I finished high school, literally, I was just glad to be out. I was just glad to have finished school. I was intimidated by the math and the science. And I wanted to do something as close to it as possible. I knew I wanted to help patients. I just couldn't go through all of the schooling and stuff. And my older sister was a medical assistant. So I said, I'm going to go ahead and do that. But I have a degree in psychology as well. So I did go back and get a degree in psychology because I like counseling people. I like, helping people and stuff like that. I have a certification in life coaching. So I do have a degree in psychology that I plan to further one day you know, to possibly all the way, right, to PhD. So she said, "Go girl, you got this." I don't got this. I don't want to be a doctor now. The most I would do, like I said, is further my degree, my psychology degree to PhD, and I'll be doctor then. But as far as MD, no. I have no desire to be a nurse or a doctor, a medical doctor anyway. MD anyway, maybe PhD, but not MD. I love what I'm doing. I love to teach. This right here, my videos on YouTube, my refresher course, this is what I love to do. That is what I love to do. Okay, let me see. I think I missed something. Let me see. Just asking because I don't. Oh, a medical assistant. So you said you're asking because you don't know what is a medical assistant. Oh, okay. So medical assistant. So we assist the physician. So you know when you go to the doctor's office and you know that person that brings you to the back, that's checking your blood pressure, drawing your blood, giving you injections and all of that, helping the physician out. That most likely is a medical assistant. Could be a nurse possibly, but most likely it's probably a medical assistant. So that's what we do. We assist the physician in a nutshell. We do a lot more, but that's it in a nutshell. Amaya says, I need help. I start externship in April and I'm scared. I have a video on externship tips, Amaya. I do have a video on the externships. So I'll just give you a few here. You can search my channel or you can just go to YouTube search and go externship tips, Miss K, and it'll come up. But I'll give you a few tips here, Maya. One thing I would tell you is to just prepare in advance. So whatever specialty you're going to, just kind of get prepared. So let's, for an example, say you're going to a cardiology specialist. Just kind of look up, what do medical assistants do in cardiology? They do EKGs all day, vital signs, maybe doing some finger sticks. If the patients are on blood thinners, if specifically Coumadin, they may have to get their INR levels checked. And so things like that, just kind of get prepared, and also just be prepared to stand out. Okay, don't get too caught up in other people that are there in the office. Just go there, get there every day on time. Take initiative, meaning if they need something done, just do it. If the chairs in the lobby haven't been wiped down, you don't have a patient, things are slow, go wipe the chairs down, go straighten the magazines. Just take initiative. You know, like I said, get there every day on time, actually early, get there a little early every day. Take initiative, stand out. Do not get caught up in any of the office gossip or office politics or any of that, because I always say this because I've seen it happen. I had a student who got close with someone who was on their way out, meaning this was someone that she could have possibly replaced, because this person was like a problem person in the office, right? This was the person that they were pretty much on their last leg, and the office was going to get rid of her. And my student happened to get close with that person on externship. So guess who didn't get hired? My student, because, you know, they look at it like, you know, this person is on their way out and now you're buddy with them. You're probably just like them. Okay. So this is why you want to kind of stay to yourself. Kimberly says, got to go enjoy your meal. Thank you, Kimberly. I definitely hope to do so. So yeah, so when your externship, you want to just kind of stay focused. You're there. It's a working interview, especially if they're hiring. Okay. Even if they're not hiring, you can get a recommendation letter from them when you're done. So look at it as a working interview. Alandra says, hey, Miss K, I take my exams. In an hour. Oh, good luck to you, Alandra. Alandra, y'all send some good luck, some good vibes to Alandra. She's about to take her test in less than an hour. Wow, good luck. Make sure you come back and let me know when you pass, Alandra. Nelly says, I didn't pass my NHA exam the first try, but I purchased your MA refresher and it's helping a lot to prepare for my exam. So glad to hear that, Nelly. For those of you that don't know, or maybe just joining, I have an MA refresher course that helps to prepare for certification. It's 12 modules, video lessons. I teach a lesson, and then there are quizzes after each lesson, and then there are practice tests at the end. So that's what Nelly is referring to. I'm glad to know it's helping. I'm so glad. Make sure for Nelly and anybody else that's preparing to take the test, or especially for those of you that's planning to take the test again, Nelly, make sure you look at your score report from when you took the test before. See what areas you fail below, okay, below the passing standard, and make sure you've really doubled down on studying those areas, okay? For anybody that is about to take the test again, do not take the test again without without going over finding out where your weak areas are, finding out where the areas you fell below the passing standard, and then really double down on studying those areas. Okay. If you have my MA refresher course, go through that lesson first. So if your weakest area was EKG, if you look at your score report and it says EKG is the area you scored the lowest in, you want to go to that section on my MA refresher course, watch that video, take the quiz. Okay. You really gotta, because what's going to happen is if you don't do that, guys, you're going to fail again. So you always want to find out, okay, what was the reason I failed? What areas did I fall short in? And that's what you want to study again. Yeah, you might not get the same questions again. However, if that's the area you're falling short, even if you don't get the same questions, the different question, you're still going to get it wrong because you didn't go study that area again. Miss Cam, a medical assistant certified through NHA, and now I'm a pharmacy tech studying for the pharmacy. Okay, good luck with that. I love it. I love to hear when you guys are stocking your credentials. So Jonathan is already a certified medical assistant and now getting certified as a pharmacy tech. I love it. I love it. And Alandra, they're all telling you good luck in the comments. I hope you can see the comments. Good luck. Was that Bienville? Hey, Bienville. Is that Beanie? I think that's Beanie. On the 1st. Okay, you're taking on the 1st. Oh, that's tomorrow. Wait a minute. Yeah, that's tomorrow. Good luck. Good luck, Beanie. Make sure you come back and let me know you passed. So, guys, I'm going to get ready to go. For those of you that just joined, I just came on here to announce that next week, I'm finally doing another group study session, okay? Several of you guys asked me to do this again. It is a group study session up to 2 hours. We go over testing tips, lessons, or whatever you want to go over. When you sign up, you tell me what we want to go over in the notes, okay? The link is attached in the comments in the chat, and then when I end this live, I'm going to also post it in the comment section as well. I'm going to wait a couple more seconds, see if any other questions come up, and then I'm going to end this because I am very hungry. But I wanted to go live real quick because I like to watch something when I eat. And I didn't want to be, I knew I wanted to go live real quick, and I wanted to do this really quickly because I didn't want to hurry up and eat and then go live. I said, let me go live real quick and then I'll eat. And I don't see anything else coming up. If you guys are watching the replay, type in the comments replay. For those of you that are watching live, do me a favor, up above me somewhere above there, you'll see a little thumbs up button. Do me a favor and hit that, like that video for me. Subscribe if you haven't already. Some of you guys are watching every day, every time I post, and you are not subscribed. So make sure you subscribe if you haven't already so you can be notified when I'm live. Let me see. Any other things coming up? Next week, I should be going live next week again. Possibly even tomorrow. I'll see. I was supposed to travel this weekend, but I canceled my trip. I don't want to get into why it's been. I've had a lot going on. I don't want to make this about what I'm dealing with, but I was supposed to be going on a trip today that I canceled. I decided to cancel yesterday. So I'm home this weekend, so I may possibly go live again this weekend. Possibly, if something else comes to me. So anyway, you guys have a great weekend. Enjoy the rest of your day. Be blessed.